Good morning, everybody. It has gone 10 o'clock, and I welcome you to this meeting of the People and Health Scrutiny Committee. It's the 6th of February, and I'm Councillor Tony Coombs. I chair this committee, and my vice chairman is Councillor Jane Somper. There are plenty of officers around the room who will be introduced as and when we go through the various items, but we wouldn't be here without George, who takes our minutes. So thank you very much, George. Okay, do we have any apologies?
Yes, we have apologies for absence from Councillor Laura Baddow, and just to say that Councillors Robin Legging and Claudia Webb are both online.
Okay. Good morning, both. I can see it up on screen.
Good morning.
Morning.
Okay, so as we move into the agenda, the first thing I need to ask members of the committee are there any declarations of interest which amounts to predetermination or a conflict of interest that's recordable? If there's anything that comes up during the meeting, let us know as soon as you're aware and we'll deal with it at that point. We have the minutes of the meeting held on the 16th of January. Are you happy that they're a true record of that meeting?
Chair, can I ask about the last item, or the last but one item, which was the item that I asked to be put on the agenda? When I read this last night, and I went back to the YouTube video of the meeting, and I'm not quite certain, and it's not a criticism of George or yourself, whether that quite reflects what was decided. In fact, it's rather difficult to decide what was decided at the meeting, because after I'd finished my introduction, you looked at the officers to your left and said, this has come as a kind of bolt out of the blue to them, and they're all looking a bit puzzled. And I'm just wondering how that should properly be reflected in the committee minute, because you then suggested that yourself, George, me and Jane would be advised of the officers' consideration of the request for scrutiny of this health service decision. And of course, since then, I don't think we've received a letter from Weldmar, but there's also evidence now of Marie Curie having had their funding plug pulled by the NHS for end-of-life care. And I think this is an item which at some point or other ought to be looked at by the committee. And I'm not quite sure whether the decision which is recorded on the minute is exactly accurate.
I see if I can remember outside of the meeting, and I'll talk with Robin directly about it.
Yeah. So did you pick that up, Robin?
Sorry, no, I didn't quite get that, George.
Okay. George will have a look at it outside of the meeting and talk to you directly about it.
Yeah.
When you have happy that you can agree the words.
Yes.
We will then have a separate conversation, because I am picking up that this is something that is now starting to happen nationally with the NHS, and it's not just happening to one or two endorsers. I think this is a major problem where they're starting to reconsider all of that funding. So I think maybe you've been proved right, that it is a bigger issue. So we will have a discussion about it.
Yeah, that would be good.
George, Jane and myself.
Yeah.
Look to see the parameters and then consider whether or not we can then add it to the work programme.
That would be good. Thank you for that, Chair. I'm sorry not to be with you in person today, but you're probably all glad that I'm not with you. of what you might get as a result of me being there.
In respect to the actual specific point that you made about the bolt out of the blue, that was in reference to a statement that was made in the response or in that letter that adult social care were absolutely not aware of, and a conversation to happen around that, Madam Chairman.
Okay. So we will clarify all of that, and then when you're happy, Are the rest of the committee happy then to accept the minutes with that minor amendment?
Yeah.
Yeah. We'll then agree to move on. Okay.
Thank you very much.
Okay. So we have notification of a public question. The questioner is not here today. However, I did think it would be important, because of the live streaming, that it's quite a short question and a fairly short answer. So if I read out the question on behalf of the member of the public and then perhaps invite Claire Sutton, portfolio holder, to answer it. Okay, so the question is from Jenny Murray on behalf of Women of Dorset. In light of the data from NHS England indicating that Dorset ICB has the highest child referral rate per 1,000 head to NHS child gender clinics, can Claire Sutton and Sunita Katra-Hall assure the committee that all Dorset Council, PDSCP, DSCP resources and training have been reviewed, updated and aligned with the findings of the CAS review, KCSIE statutory guidance and the government's commitment to implementing the recommendations made? I will then refer you now to Claire Sutton for the answer.
Yeah, thank you, Tony. So Councillor Claire Sutton, Cabinet Member for Children's Services, Education and Skills. And I'd like to thank Corporate Director Sunita for providing me with the answer, which I'm going to read. So to confirm, thank you, Jenny Murray, for the question. To confirm, the training course being offered on gender identity is aligned to the CAS review and keeping children safe in education. That's KCSIE. We have reviewed the current content statement on Dorset Nexus for gender identity training and have recognised that we have not explicitly stated that the training is in line with the CAS review and KCSIE. Therefore, we have taken the course content down to reword the content statement to make this explicit. It is not correct that the course was deleted last year following concerns being raised. Rather, it was the case that all sessions commissioned for that year had actually been delivered. The course is open to professionals, and we are aware that requests have been made to open this content to parents and to Women of Dorset, etc. The training is for professionals on gender identity provided by an external provider. The external training provider has provided their rationale for not sharing their content to the Information Commissioner's Office, and on appeal, this has been upheld. Dorset Council cannot overturn this decision. Thank you.
Thank you very much. A copy of the response will be emailed back to Jenny Murray, so you have full sight of it. So thank you all for that. There are no questions from members of the council and there are no urgent items. So we will be moving on to our first item, and that's agenda item 8, Dorset Safeguarding Children Partnership. We are going to be receiving the annual report, and I understand that you're going to be presenting it, or introducing it, I should say.
Well, it's all before you. I won't repeat anything that's in there, but Sunita's going to flesh out a few of the more interesting parts.
Okay, over to you then, Paul.
Sorry, Paul Dempsey, Executive Director for Children's Services. In my copy of the agenda pack, the birth to settled adult report comes before that, so I don't. It doesn't matter.
Let me just go out to say that I'd turn the agenda around so that this item was coming first, because we anticipate it to be a fairly short agenda item. But Sunita.
Thank you. So the Dorset Safeguarding Children's Partnership is a statutory arrangement made up of local authority, police, health and education sector, who work together with relevant agencies to safeguard and protect the welfare of Dorset children. The report in front of all outlines the functions, progress and activities of the partnership, which was undertaken in 2023 to 2024. And it highlights, again, as I've said, the duties and successes and further areas of development. Hoping that you've all had a chance to read it. Some of my highlights, I think, are that just to clarify that we have maintained priorities up until 2025, and these are priority 1, violence experienced by children, young people, including sexual violence and abuse, domestic abuse, physical violence and knife crime. Priority 2, children's mental health and emotional well-being. Priority 3, neglect. The report outlines a number of areas in which we identified that we needed to do some improvement. And I would like to update all on where we've progressed with that. So Dorset Council and Bournemouth, Christchurch and Poole have now decoupled their arrangements quite successfully and have moved to working as separate safeguarding partnerships and having those arrangements, and they have gone well and smoothly, and we have continued to work on all areas under our priorities. Another action was to develop scrutiny arrangements, and what was well received was we tested those scrutiny arrangements before they needed to be implemented this year, and we focused on the area of neglect. It was a very successful collaborative piece of work. We had an independent scrutineer commissioned to do the work, great findings, good engagement with the workforce across the partnership, good engagement with children and their families, and we developed some really good insights into some of the quality of our services and practice. That resulted in an action plan, and we've already progressed some of those areas. An example of that is embedding assessment tools which were not being used across the partnership. In terms of implementing working together, that was updated. So working together is our statutory guidance that has been published by the government, and we had a deadline of implementing it by the end of December. It is really positive that I can say that we put all those arrangements together before time. And one of those arrangements, and which is beginning to show real successes, is bringing our education as an equal partner to those safeguarding arrangements. And I wanted to highlight particularly that we've developed a education safeguarding board which has 38 active members across early year, primary, secondary and post-16 settings. It includes maintained, independent and multi-agency academy trusts. The board meets 4 times a year and is chaired by the Corporate Director of Education and Learning. As part of that as well, we have education leads embedded in all of our safeguarding partnership arrangement meetings, and they are contributing to even more discussion and understanding of children's needs and how we promote their welfare.
Thank you. Did you?
No. Okay, I'm coming in. I've got a couple of things really. Firstly, you talk about bringing in education.
Sorry, Carol.
Sorry.
Say who you are and where you are, where you're from.
Carol Jones, Sturminster Newton. You talk about bringing in education. I mean, it was just. I'm surprised they weren't in this before, actually, because I mean they're just absolutely paramount, aren't they? But I wonder, with the formation of family hubs, especially when you're talking about early help and so on, the family hubs are going to be a real boon for bringing in young families, young children doing early help, speech and language, parental and infant relationships and so on and so forth. So I'm just wondering how you're going to think about bringing in the family hubs. I do have another point on mental health, but I don't know if you want somebody else to talk before that.
So we bring in every part of the system, or how families come in from early help all the way to when children leave our care. So in terms of how we consider them, we have a partnership dashboard. We have in terms of our priorities, when we're thinking of one of our priorities with neglect, and when we're looking at our scrutiny arrangements, we were thinking quite early on, we bring in practitioners from our family hubs to support us think about that early intervention, so that when we pull together our findings, and this was done by our scrutineer as independent, so it's really testing us. So Early Hubs is part of that arrangement. When we look at our children and families coming and the work that we do, we look at it from that, and we do bring the so they are considered throughout.
I'm just not sure how they're considered. I mean, we're in the process of opening our own family hub, and I certainly haven't had any contact. I mean, our volunteers and staff have done safeguarding level 3 for children and so on, but I certainly haven't had any correspondence or communication in that respect. So I'm not sure if any of the others, Wareham, Ferndown, etc., have, but you might want to just look at that, because it is a growing, there's a growing number of families and young children entering those establishments. So that was that. Also, your priority 2 is regarding children's mental health and so on. I'd like to know exactly what is being done in that respect, because I can't see that anything is improving in that respect. And I've got a mad idea, but whether or not I can push that through. But I think one of the main problems with children's mental health, and certainly their emotional well-being, is their attachment to the phones and social media. And I would like to know how we, if we're working with education, can actually do something about mobile phones in schools to protect the children, because I think it's really damning. If we look at how long ago did mental health really become a problem, and I think you'll find it coincides very well with social media, phones, and so on. So what can we do in that respect?
It's Beth Whitaker, Interim Corporate Director of Education and Learning. So within a lot of our schools now, they have operating a no phones policy, whereby they hand their phone in to a magnetic bag at the beginning of the day. Children and young people can't access their phones during the day. It's quite interesting because it's obviously been in the news this week, and there's quite a lot of sort of research papers been written to indicate that actually it's not it. Although there are improvements around the social media piece, there's also the piece that is happening at home as well, and the use of mobile phones in the evening. So I think we kind of need to extend this just beyond schools, and we need to look at how we work with parents around this as well. I mean, it's still very much down to the discretion of each school as to how they manage mobile phones. But we have had feedback, sort of anecdotal feedback from some schools, that they've seen improved socialisation between those schools that are opting to remove phones during the day. And that has kind of reduced difficulties around social media use.
Thank you. So what powers do we have to make it mandatory across all schools, or do we not? Or can we get them?
That would have to go to sort of DfE, to government level, just to get that kind of, they'd have to be statutory.
So we don't have any powers in Dorset ourselves then to do that with our own Dorset schools?
I mean, we can encourage them, and we can do it in such a way we look at it through our belonging strategy, and we look at it, when we're kind of addressing issues in relation to bullying or to children feeling that they belong. We can look at it in that way. We can gently support around conversations around that, but we can't actually enforce it. Obviously, we have more jurisdiction over our maintained sector than we do over our academies. But I think because it is, very much in the public domain at the moment, I think, I'm hoping that we will see some kind of change at a higher level coming in.
I'd just really like us to be at the forefront of actually pushing for that change and doing more. But I think our hands are probably tied. I just find it frustrating because it carries on and it gives us extra costs and problems down the road. But I'll leave it there, Chair.
Yeah, I just wanted to bring a bit of extra reassurance. I was in the Education Board safeguarding meeting. I think it was last week, and there was quite a bit of discussion about this, wasn't there? And there was some schools that have already adopted this, are offering to sort of mentor, for want of a better word, other schools. So within the system, you can see this, you can see movement on this across the wider family of schools, I guess. Yeah.
Okay, thank you. Perhaps we could push this through the schools forum as well.
I think it's, yeah.
Yeah, we can certainly raise it. I think as a workshop and potentially at our Leeds meet where we meet with all our head teachers. I think it, and in relation to sort of online safety and all of those different elements, and we do also push it through our PSHE curriculum offer and the work that we do with schools around that. But there are certain, I think there's an opportunity here to potentially even run a pilot within a school.
Love to see that. Love to see that.
That's something that I can look into.
Can I also suggest government training?
Yes.
Particularly in safeguarding governors, because in the past I've been involved with that. And if governors are holding the schools to account, and if the governors then understand, it's just another way of pincer movement, isn't it?
Yeah. Just urge people to watch that programme on, it was Channel 4, I think, with Matt Willis' wife. It was just extraordinary.
Yeah, hi. We did also hear yesterday about reports of bullying going down in those schools where they've reduced or banned the use of mobile phones. That's another positive aspect of that. Beth mentioned inclusion and belonging, really important to do as much as we can to make children and young people feel included and that they belong in relation to their mental health. And obviously we're working with partners to support children's mental health and health service going through the sort of DAMS transformation sort of review program at the minute. So very much waiting for that to come to fruition. And lots of our services have health service professionals, mental health professionals in them, our educare services, some of our in-care services. And also we're looking forward to CAMS Gateway becoming part of our social care sort of front door, family support and advice line, so that we're working together in a unified way to address children and young people's mental health difficulties. So
does that answer your questions?
Thank you very much. I shall carry on pushing in my own little way.
Rome wasn't built in a day, remember. Chris. Oh, sorry, Jane.
Thank you. Sorry. Councillor Jane Sumper, Beacon Ward. I'm not actually going to say much because Carol brought up the point that I really wanted to ask about in online safeguarding, particularly in relation to schools, but also to understand what Dorset Council and Children's Services can do outside of the school setting, because in schools there's obviously a lot more oversight and opportunity to restrict use of particularly mobile phones, but it is, of course, it's not just about social media, it's also about apps, and there's some quite, I'm not sure exactly what they're called, but dark apps or dark web activity, which is very damaging and very concerning. And obviously adults use these, but young people and younger people are accessing these. So it was really to say thank you for that. Really important point. No, it's absolutely easier. But what can Dorset Council do in outside of those areas where you have obviously lots more interaction and abilities to influence? And you were talking about education and educating families and parents in particular on these. Well, they are dangers. Actually, they are. I believe they are dangers to our young people. So could you just expand a little bit on what the possibilities are and what you might be thinking about pushing forward?
Thank you for the question. So what I'd like to say is that there is an offer that's not just for schools. As part of the safeguarding arrangements, we have a learning and development offer for the workforce, and online safety is offered to all professionals. So that includes our health colleagues, our voluntary sector, and police colleagues, etc. So that is on offer, and I did get some numbers about take up of that, and so we have a steady every time we offer it. We have a steady about 20 delegates that attend that across the partnerships. So we have that offer. We also have raised a particular area of risk to our children and young people online, is that where there's been sharing of sexual images. So what we have done, as you will have read in the annual report, that we've had annual conferences, and at our annual conference this year, we've raised a report, Remove It, which is a Childline collaboration with social media, and that's where children can safely and anonymously request if they've had images posted of them, they will get them removed. So that is also published in our newsletter. But actually, when I'm thinking about it, we can probably do a lot more in terms of raising awareness of a very, very, very worrying area of safeguarding. So we are taking that this month to one of our partnership meetings, where we have delegates across all partnership think about what more we can do to embed raise awareness, not only of the online risk, but specifically around the risk of sexual images.
Thank you very much. That's helpful to know and to understand. I think there's also perhaps a perception that it's what children's services refer to as the vulnerable children, but all children are vulnerable. And there will be many, many, many parents who have absolutely no idea that these things and these images are being shared and these activities are going on. So I think trying to raise awareness with parents as well as the young people, because I think actually the young people know a great deal about this anyway, but I'm not sure that all parents do. And that's where, what influence can we have to raise that awareness of the, because I have to say I had no idea about this stuff. A friend of mine had some incidents, and I was shocked actually, and it's prevalent, and I had no idea, and I'm a parent. So there will be many parents who just don't know that these activities are happening, and if there's any way that we can influence the awareness in a bigger way, in a really important way, because terribly damaging long term for young people. If we can, then we should.
And I think that's a really good challenge. And I think when we have the meeting at our multi-agency quality assurance and action group this month, I think that's exactly what we should be thinking about in terms of how do we raise awareness. So there'll be actions, as you said, vulnerable children within our kind of social services sphere, but wider in terms of how do we maybe, just thinking now about things that we could think about is how do we raise awareness maybe in GP surgery, so that parents that go in there. So I think that we definitely will take that back and develop some form of action plan.
Yeah, it's about having the conversation, just opening up the conversation. Thank you.
It sounds to me as though there's an avenue there to work with the PCC, because there is grant funding available for reduction in crime. So this comes under crime prevention, so maybe there could be something by partnering up with the PCC, maybe some funding.
Well, and important work with our schools, I think. I know you're talking about out of school activity, but as Sunita was implying, most of the sort of children and parents in Dorset don't have engagement with our social care services, do they? But most of them, the large majority, do go to schools or some kind of education setting, and the parents are involved in some way with those education settings. So I think it's a sort of multi-partnership sort of approach really to educate families, parents, children, young people about that. We can't obviously do it on our own. Yeah.
going to move on now. Chris, you've been waiting very patiently, and then I'll come to you, Robin.
Okay.
Thank you. Chris Kippax, Yetminster Ward. I'm leaving aside the history of the extent of the involvement of education in these forums. I'm interested to know from the education perspective about what they feel initiatives they feel can be taken to strengthen safeguarding children. I'm thinking, we're talking about mobile phones and social media and those potentially very negative influences. But I'm also thinking that education and its surfaces not infrequently, are burdened as well with taking responsibility for what, for want of a better phrase, one could describe as sort of neglectful care within family homes, and having to clean children's teeth and obviously care for their nutrition in a way that isn't apparently being done at home, and how both that must be of day-to-day concern within schools as well, and how do they see the improvements being possible within education when they're already dealing with such a range, and we're talking about more here already, about more responsibilities that they have. Hard to argue they don't have them, but that there's a limit to what they can do. But I don't mean limit, I just mean, how do we support those, and what does education themselves, what the schools think that they can do to make changes? Sorry, that's a bit rambling, but I think the sense is what I'm saying. It's about schools being burdened, but it's also about them being the front line of many of these things.
Yeah, that's where the kind of in terms of us leading the way with education as the fourth partner has been really helpful through the Education Safeguarding Board, and we've done quite a few workshops around this, and we've had a lot of opportunity to have representation across our schools workforce, so with head teachers, with chairs of governors, with designated safeguarding leads. And one of the things that they've brought to the forefront for us is around their own well-being, and the fact that the scope of their job has increased much further beyond just subject teaching. So one of the things that we're currently working on is looking at putting a form of supervision and debrief training into schools, drawing on some of the expertise from our educational psychologists, just to kind of better prepare our schools and our teachers, our leaders for managing really complex safeguarding. Another aspect of it is that sort of whole inclusion piece, and it's sort of the contextual safeguarding that goes wider is being reviewed under the Ofsted framework, and we've got a new Ofsted framework that is due to come into play from November. So all of these kind of conversations are kind of happening at the moment, and we're working with schools, particularly in Dorset, to really support them in managing the challenges, the range of challenges that they're experiencing.
Which are very considerable, just what we were saying here this morning. Okay.
Can I just ask a question on that? This new framework, is this something that will be implemented nationally, or is it something that is a framework that we will then have to write our own policy around?
Do you mean the Ofsted framework?
Yeah.
Yeah. So the Ofsted framework is changing nationally. There were announcements this week just to talk about the report card and about how schools will be judged on a 5-point scale under 11 different areas. That's very much in consultation at the moment, but there will definitely be changes. The key changes are in terms of the breadth of the inclusion piece, and looking at sort of working to holding schools to account more around attendance and around looking at use of alternative provision and those different things. The timescale for that is we anticipate that we'll hopefully see a kind of draft version of the framework by the end of March, which we will then be able to work with schools over. Ofsted are suspending their inspections from September through to November. with a view that will give Ofsted as a body an opportunity to train all the inspectors ready for the framework being fully implemented from November.
So there's nothing in there that will require any changes of policy within the council that you're aware of at the moment?
Not that I'm aware of at the moment. Yeah.
Yeah, can I just come back? So does what you describe as the inclusion piece, does that address the concerns that I'm raising, which the schools, you know, are having to deal with day to day?
It may well
children.
It may well do. I sat on a national panel recently where Ofsted had brought in an external research organisation to really explore what inclusion meant across the entire education sector. So when we get more details around the framework, hopefully that we'll have a much better idea as to exactly what inclusion means, and that will be really sort of pinned down to individual areas.
Yeah, I just wanted to add some context. So the concept of education being the fourth safeguarding partner that Beth and Sunita have talked about, that is part of our Pathfinder model. So the Pathfinders have been going with lots of different changes around children's social care. One of them has been about making education what's referred to in the transformation strategy, the government's transformation strategy, as the fourth safeguarding partner, alongside council, health and police. Well, our education sector has embraced that so much that they're quite offended about being the fourth safeguarding partner. They want to be an equal safeguarding partner, i.e. you don't get a medal for fourth type thing. So let us get on the podium. So that's really, really good and exciting. They've been really positive in terms of the impact of that for them being involved and feeling like they're being involved, and that communication channel, being able to make sort of joint decisions. And not only are we putting in sort of oversight board arrangements that education sector partners are in, but actually they're involved. People in education settings are much more involved now in the day-to-day work. So as part of our sort of transforming our child protection space, we've created weekly multi-agency line of sight meetings, we call them. That's where the multi-agency team meet every week to discuss families, cases where we've got concerns, child protection risks. Now, we used to have them, but they weren't multi-agency. It was just us in the council doing those meetings. Now, as part of our Pathfinder work and deeper integration, they're multi-agency. So we're getting schools people that know children, know the concerns, want to hear how we and other partners can help in those meetings, taking part in decision making. So we're now doing the agency decision making involving the school sectors or the education sector. So they're saying they really like that. So in a bit of an answer to what a school's saying, they're really liking being much more informed, able to input on sort of policy and quality assurance, but also that day-to-day multi-agency decision making. So you know, school sector's really sort of excited about that. Some of the other Pathfinder sort of things we're doing is we've been able to put additional capacity, targeted youth workers in, extra family workers. They're all sort of linking and supporting with schools and indeed family hubs. So the question that someone asked about, you know, will the rest of the nation be doing some of these things? Yeah, the rest of the nation after April will be doing what we've done in the Pathfinder. So they will have to make education more involved in all of their sort of child protection stroke safeguarding.
I mean, I'm not going to question any more questions, but could I be assured that we'll come, you know, from education perspective, that we come back to this? I mean, whether it's in the next annual report or there's something there that I think I'd very much like to see. We need to frame that up a bit more carefully, but yeah.
Make a note of it, otherwise I'll forget.
Perhaps we could have a conversation. Thank you.
Thank you. Robin.
Thank you, Chair. I think what Carol said to start this conversation this morning is really valuable. I'm not quite sure that I'm clear in my mind what the officers are going to do as a result. I'd like to think that, at least in the maintained sector, we will go off and identify those of our schools who have a policy of removing mobile phones from children during the day, and that we draw up a list of those that do and a list of those that don't, and that we then either encourage or ask whether those who do would be willing to mentor those who don't. I think something needs to come of the issue that Carol's raised this morning, and I think that's a fairly easy thing. Well, at least I hope it's a fairly easy thing to do, so that we know within our own sector, particularly at primary level, where those schools are actually removing mobile phones from children during the day, or at least making them inaccessible in terms of access to the internet.
Yeah, thank you. And something that we can do is, once we've extracted that information, and if what we tend to do is share really good practice. So we have a fortnightly meeting, which is leaders in education across Dorset, and we can invite head teacher to speak to our other head teachers about any successes that they've had by removing mobile phones. So that's something that we can action.
I was just going to add, and I was talking to Beth this morning, and she reminded me that we do have an online safety bill that is national, and it does make it a legal responsibility for social media companies to keep children safe. We are waiting for Ofcom's guidance around that, and we will take that forward as well.
Start, but a slow start. One of the things that sort of come through in all the conversations we've had about the various issues this morning is about how we disseminate learning from findings, from things that are happening. I suppose what interests me is we talk about learning from the past and making change. How do we embed that and make sure that things don't happen again?
Well, when talking generally, if there's learning, I think you've seen in some of the reports, we'd say we learn from child safeguarding practice reviews, for instance. So when there's learning that comes out of those national sort of reviews, we review our policy and practice. If it's something new that we have to do, we revise and rewrite our policy and practice. We then, if there's training we need in relation to staff to be working in a different way, we deliver training to staff, and then we monitor the impact. We monitor compliance and we monitor the impact of what we're doing. So
how long do you monitor that for? How do you know that it's really embedded and practice has changed?
Yeah, depending on what it is, we might monitor it forever. There might be a new performance indicator, for instance, or something that we're monitoring. But otherwise, we normally have 3-month or 6-month reviews to make sure that it's embedded. It depends on the actual kind of change. Yeah.
I was going to say, so we have actions. We have an action log that's transparent. It goes through our governance structures all the way to our strengthening services board, and so we are then challenged. We are scrutinised constantly on one. Have we done something about that action, or the action, or the recommendation? Secondly, we don't close it off once we've just got an action. We have to then revisit it. So we give a timescale of when we will revisit it through quality assurance activity, which is not just about auditing, but it's about getting feedback from our workforce and from our children and families, so that it's embedded. If once all that work has been done, senior leaders, exec leaders are satisfied, we will close that action down. Nevertheless, it may come up again, and we can revisit what we've done. For specific actions where there's been a serious incident, we have to submit those to the National Safeguarding Panel. They review our action plan, and that will be taken forward in any inspection or regulatory inspection that we have. So we're constantly tested on if we have something that we have delivered to that.
Let me give you a scenario that I was made aware of yesterday. When I was the portfolio holder for children between 2005 and 2015, as it was then a serious case review, child H died of diabetic ketosis. Family circumstances were not supporting the child. The child was aged 10 and was left basically at school to administer their own medication. I was informed yesterday of a similar case starting to happen. The child was originally in the Purbeck area. They are now at school in the wider Dorchester area. And they have type 1 diabetes and they're having to self-medicate. When that serious case review happened, about 2 years afterwards, I did Safeguarding 3, and it wasn't in the governor training. So I got it added. So my question is, if it's embedded, why is it being allowed to happen again? Because we hear it time and time again. We've heard it with Victoria Climbier, baby Peter. You know, learning has been done, we've made changes, and yet something happens again.
I don't know about that particular.
I can give you more detail.
Yeah,
I'm not going to do it in a public arena, but I can
really
do it
happy
outside
to
this meeting.
talk to you about that. Yeah.
But the question is, how do you ensure changes and training are embedded so that things don't happen again?
So to answer that, I suppose it's always very difficult in the children's safeguarding space, and if we think nationally, that is a question that is asked again and again, particularly when things are in the media and the national. I think what I would say is that when we put action plans in, when we monitor them, we do see changes. We have a committed workforce that does do that. But unfortunately, like any other organisation, there will be elements where we may not have fully embedded it. There might be new staff, there might be turnaround, there may be changes in leadership. And when we hear of further incidents, it's how quickly we react and go in and kind of wrap around any education space or any organisation, so that we've learned those, you know, we've got and we can revisit that with particular organisations, particular staff members. So it's really difficult to give wider assurance that it'll never happen, and that's what we strive for. That is what we do constantly as a safeguarding partnership. There may be times when it doesn't go exactly as the action plan, and we have to go and visit that. So as Paul says, if we can hear about that particular child, we can see what further wraparound support and advice and guidance we can provide.
Yeah, I think in this particular case, it's about how the school do their safeguarding.
Yeah. What we do is through our Leaders in Education touchdowns is we do regular kind of raising of awareness around things, and we've had a case that's been brought to us recently that happened outside of Dorset around allergy management, and with a child who you know, was exposed to a food substance of which they were allergic to, and there were significant consequences. So in response to that, what we've done is we actually have the allergy management code team who will be speaking to our head teachers next Tuesday. With regards to administering of medication, every school should have a policy around that. So what I can do within my role is we can remind, raise awareness and keep reminding. We have a school improvement team who actually, as part of their checks on their maintained schools, go through all of their policies to make sure that they're all up to date and that they're in line. And then it's
not just the policy, it's how they
carrying out
and how they flag that child's case file within the school.
Yeah, because
the school will be aware of that condition, and they therefore should have a red flag and they should be monitoring it.
Thank you very much, Chairman. I wonder if officers can talk about areas of safeguarding that are unique to Dorset. Do we have any that are unique?
I'm not sure we have any that are unique. There are differences sometimes in Dorset to other places around the country. We have different demographics. You know, we have a coastal demographic, we have a rural sort of demographic. We face most of the same issues and problems that other councils around the country face. Dorset's often thought of, I think, outside of as quite a wealthy place, but we have real pockets of deprivation, don't we? So just like everyone else around the country. So and we have harms to children inside the family and outside the family, different kinds, like is everywhere else. So I don't know really that I could identify anything particularly unique to Dorset.
Just to add, but sometimes the way it shows and how it manifests itself can be different from when we're living in kind of an urban and rural. So, for example, domestic abuse, that can show, and so we are mindful of that. We work with our community safety officers as well, so that we make sure that we are sighted on all children everywhere. So, yeah, so it's just to support Paul saying Dorset has a unique geography, and we need to be mindful of that. Not unique, but you know, and look at how children live in those spaces and places, and how any harm or abuse may manifest and show up.
Thank you.
Oh, you want to introduce yourself?
Oh, yes. Councillor Colwood, Gillingham Ward. I'm just curious about the kind of multi-agency nature of this, and how you manage the kind of responsibility and accountability aspect, both in a practical sense, I suppose, how you making sure no one's like overlapping responsibilities and all that, it's clear who's doing what, and also in a financial sense, obviously in terms of funding. And you know, there are loads of benefits, I presume, from multi-agency work, but there must be loads of challenges that you guys have to kind of resolve to kind of get that working smoothly. So just if you can elaborate on that, that'd be cool.
Yeah, so we have a number of different sort of governance spaces that are multi-agency. So the Children's Safeguarding Partnership, which essentially the report is about, is multi-agency, and that is joint funded from the different agencies. So and that board comes together to discuss in an equal way and have governance over partnership safeguarding arrangements. In Dorset, we have a strategic alliance, which is a multi-agency board, and that oversees the delivery and the development and delivery of our 10-year children, young people and families plan. And that is a forum that meets regularly to oversee that, to hear reports, and to discuss the effectiveness of the partnership working as well, I suppose. And I think you're alluding that sometimes there might be tensions, and sometimes there are tensions. As a Director of Children's Services, part of my role is to manage and lead the system, as they call it, of partners and organisations that have to secure the well-being of children and young people in Dorset and make sure they're protected. So, so as I say, part of my role is to make sure those systems click together and work, understand the risks and concerns to children, and make sure that together we're doing something about it. It's a sort of high support, high challenge environment. So when we are concerned that a partner isn't doing something that they should be doing to safeguard children, we'll say so, and they'll do the same back to us. There's often tensions about funding that elected members might have become aware of, and that's often a sort of an area where there's a bit of that sort of high challenge, but also in an environment where we're all understanding that actually if we work together better, there could potentially be efficiencies for all of us and improved outcomes for children. So that's the way in which I'm trying to work with partners, so that we're focusing on prevention and partnership, two key words from the council plan there. Yeah, so those are the two of the key sort of governance spaces, I think, for partners. Yeah, we've got Caroline just advising me that the Pathfinder, which is a big part of our work programme now, is a partnership innovation, I suppose. We've got a partnership board that meets every 6 weeks that has overseen the design of our Pathfinder model and now the delivery and sort of monitoring of that. So that works really well, and particularly what's worked well in that is that we seconded a health colleague from the health service and a police colleague into the programme team to do that design work and the implementation work, and that has worked really well, and we paid for that with the DFE grant money that they gave us. So there's some examples of the governance and how we work together as partners. There's always attention, just to be realistic, there's always attention about who funds what and etc. But we have a number of projects that are multi-agency. So our Safeguarding Families Together, you'll hear about the Settled Adulthood in a minute, which is sort of partnership approach. We've got our Harbour in-care, edge of care service, where we've got police staff, speech and language therapists, psychologists. So we're very much looking to enhance that multi-agency working. And you heard earlier, school sector now getting much more involved in safeguarding.
That follows on for me 2 questions. The first one, you talked about people from other disciplines, health and police, being part of the Pathfinder funded by DFE grant.
Yeah.
So what's your exit strategy? Because that grant isn't going to last forever. How is that going to be dealt with?
Yeah, it's not going to be last forever. We have got funding for 25-26, and I've got a meeting with the DFE to discuss the level of that funding tomorrow. The national sort of strategy around that funding, because councils nationally are receiving funding for 25-26 to roll out the changes that we've made, and the strategy from the DFE and the government is that the nature of Pathfinder and the direction of travel is that significant investment in prevention services, which are cheaper than high cost child protection and children in care services, investment in supporting families really early in their journey will pay for itself, because we won't then, as councils nationally, have to pay for the same amount of children coming into care and going through the court system in the child protection system.
So they would roll into our payroll, is that what you're saying, when the funding dries up? Or will their home organisations be paying the future?
Sorry, I didn't. Are you still talking about the seconded health and police staff? Yeah, depending on the extent of the funding we get, and I'm still doing this work, will depend on how much of the total Pathfinder model we invest in as we go forward year to year. The addition of the health and police colleague into the design sort of programme team was a temporary initiative to do the design work, really. So, and that's been ongoing for over a year now. So that wasn't meant as a way of continually delivering the programme. So yeah, that won't continue forever.
The other element, of course, is adult services, because adults work in partnership as well, and we need to remember that this committee is people, not just children. And I'm aware we've had quite a focus. So I'd like to give Julie the opportunity to talk about the issues around holding partners to account and the finance arguments.
So, like children's social care, we have a adult safeguarding which predominantly holds the responsibility for oversight of safeguarding adult issues in the council. The local authority has a lead role in safeguarding in terms of it's our responsibility to ensure all vulnerable adults' concerns are understood and triaged, but that partnership space is held in the statutory function with the police and the NHS. The board, of course, has a breadth of partners who sit in it, so housing, community voluntary sector, and prisons, etc., are all part of that partnership arrangement. We also have a number of quality assurance arrangements, like children's social care do. We have a quality assurance programme that looks at how we are monitoring, reviewing and putting into action lessons that we need to learn. We have a very robust significant event audit process that we use in adult social care, where we undertake action planning around any unexpected death or any untoward incident, and that forms part of our feed into those safeguarding adult boards, and also feeds into the work we do with the coroner when we have incidents. I sit on both the Community Safety Partnership Board, as do members of my safeguarding service. So that again allows us to work in those partnership places across not only the council, but into that wider community of organisations that are responsible for community safety. And I sit in the children's safeguarding arena on their boards to make sure that we're working in partnership with children's social care. So I'm confident that we have the structures in place that monitor and oversees all of that. Inevitably, there are always incidents where you can identify that better partnership working would have delivered better outcomes for people. And we have a series of safeguarding adult reviews that are in progress at the moment, which are evidencing how we pull the learning from those events and put them through.
Thank you. Carl, did you have another question?
Just one more. It's just about complaints from the public. Do they go to an individual part of the partnership and they deal with it internally? Does it go to a central location and it's disseminated across the partnership so everyone gets a kind of idea of what's going on? How do you handle complaints from the public? And is it even clear for them who to complain to? All these kind of things, points of contact, all these kind of bits.
Would you like me to start, and perhaps
you can do, yeah.
So forgive me because I didn't introduce myself at the start of my last comment. So I'm Julia Ringland, I'm the Corporate Director for Adult Social Care Operations. So primarily complaints into the council come to our central complaints service. That gives us the ability to not only give consistency, but as a council to understand if there are common themes in the complaints response. If it's identified that there is a partnership element to it, then either that complaints team will pull in partners from other organisations, and most often in adult social care, that is in the space of either work with commissioned providers that we work with or with colleagues in the NHS. Those complaints are usually addressed by, in the first instance, by the heads of service, certainly in my service area, who are responsible for that particular part of practice. And they will, if it's relevant and in conversation with our complaints team, then liaise directly with health colleagues. And depending on the nature of the complaint, we either give separate organisational responses because that would be the right thing to do in that context, or we work together and deliver a joint complaint. What we try to do is make sure that there's no wrong front door. So answering your question about do people know how to come in, I think it's our responsibility if we receive a complaint that should be addressed by health. I think it's our responsibility to address that with health colleagues or divert that to health colleagues rather than say it's not our problem, go and enter in a different way, if that makes sense.
Yeah, I'd probably repeat that, but just add that quite a lot of our sort of ones that might involve another agency might be a school type setting or an education one. So, but otherwise the answer would be similar to what Julia said.
Of course, I forgot that a number of issues raised by yourselves and by elected members, and so a huge route through about public concerns are through their elected members and their MPs, and very often those come in through the senior leadership teams and then are disseminated down. And sometimes those also involve that partnership working.
So I think we've had a good go at this one.
Yes, we thought it would be a quick one.
So did I, but there we go. But I think a lot of it has been about increasing our understanding as members about how things work and so on. However, some of the things that I've picked up, particularly around phones and digital safety in schools, is need to do some work around that. So we'd like to hear what you're doing about that.
Yeah.
You know, maybe in September or something like that. Yeah. Give you plenty of time to sort of implement stuff, and then we'll perhaps just have a catch up and find out where you are with that. Again, about where you are with embedding. We'd like to know, you know, what you found if you've asked a few questions about how things are or aren't working effectively. But I think most of it has been just really about understanding better, and is a testament to the huge amount of work that you do and do well. Because you know, Dorset for a long time has always had a good reputation nationally. So thank you for carrying the fame.
Yeah.
Okay. So we're now going to move on to agenda item 7, which is the birth to settled adulthood progress report. I'll put my new teeth in next week. When we did the chairman's briefing for this item, advised that some of the officers were not available. Health is not available today, and I know that the vice chairman asked for particular presence of 2 officers who cannot be here. I have to say I'm disappointed, bearing in mind that this report has been on our full programme of work, and therefore, because of the absences, I'm going to defer this item till we have the people we want around the table so we can have a full and proper discussion. Now, that means we either move it to April, which is already starting to fill up as an agenda, or we start in an extra meeting in March. I'm going to ask members of the committee first, would you be happy with an extra meeting in March if officers can find a suitably mutual available time?
Yes, depending on dates.
Okay, so George, you've got the short straw on that one, please, to organise a meeting in March where I don't want to have to go down the route of quoting the Local Government Act, but I do expect to see our officers and health present at that meeting. I know because it is birth to settled adulthood, I would like to see adult children housing. And thank you for being here, housing. But there are some key people missing. So thank you for making the effort today. But we'll bring that back in March.
Yes. Tony, can I just say I completely respect that decision, and I completely understand. There's quite a lot in phase 1 which hasn't lent so heavily on health, but I guess we'll save that for March as well, shall we?
Yeah,
fine.
Yeah, I'm not going to discuss it at all today because I want the people in the room that have the detail. Okay. So that's probably flummoxed the organisation of the day. Because I don't think the guys doing performance are here yet.
Yeah, I was going to message them and reach up to the end.
In that case, I suggest that we just take a quick 10-minute recess while we.
Thank you,
you very much. Welcome back, everybody. We're going to now move on to agenda item 9, which is performance scrutiny. And we've got Chris Highway, who's going to take us through this online, and he's the performance and analytics team manager. Morning, Chris.
Good morning. I share my screen and share the dashboard. Following last week's pre-meet discussion around performance, 4 areas were highlighted to bring forward to committee this morning. The first one for further discussion is the number of outstanding assessments, Care Act assessments. What we can see from the data from November is there's 1,070 outstanding, which is higher than this point last year, which is the rationale for the red rating. But we can see from the graph, continual decline in outstanding assessments demonstrated the strong performance across the year so far. So I'll hand back to Chair and to adults colleagues to add some context.
If it's okay with the Chair, I'd like to refer to my colleague Amy Howard, who's online, who can give additional detail behind our assessment.
Amy.
Brilliant, thank you. Thanks everybody for letting me add some context to this today. My name is Amy Howard, I'm the head of adult social care localities. At the start of April, John Price, as our Executive Director, set us a target to really focus on improving our waiting list performance and reduce the overall waiting list for adult social care assessments by 25%. So we have been actively doing some targeted work in this space. And as of today's data, I can confirm that we have been able to achieve a 30% reduction in the overall waiting list numbers that we have within adult social care. So we're still receiving a high volume of requests for assessments coming in every month. So we have over 200 requests for the statutory eligibility assessment. We call that the strengths and needs assessment. And we also have over 200 requests a month coming in for our occupational therapy assessments as well. So the numbers that you see in the performance aren't static. They're an ever increasing kind of request for assessment and thinking about how we get on top of that and make sure we do as much work early on as possible. We recognise there's still an awful lot of work to do in the waiting list space, but in relation to some of the performance that we've been able to achieve through having a bit more of a focus, we've really strengthened the approach on looking at those people who are waiting longest. So currently we have been able to achieve a 60% reduction in those people waiting 4 months or more for adult social care assessments, and really started to understand the data between the individuals who are waiting the longest within adult social care, so looking like waiting more than 12 months. And the majority of those individuals are actually young people who will need an assessment within adult social care because they're transitioning from children's services through to adults, but it might not be the exact right time to complete that assessment at this time. So those long waits just to provide assurance aren't people who we don't know about or aren't actively working with. They're individuals who, for their own particular circumstances, whether that's because of the complexities or the specialism of the work that's taking place, the need to do multidisciplinary assessments with them, are having those assessments done in a way that takes a bit longer. We're trying to get better at using a new dashboard to make sure that we can really clearly show that information to teams as well, so that we're getting on top of ensuring people are being seen in a timely way. In relation to ensuring people aren't waiting too long for assessments, we have been able to reduce the average time for assessment down by 50 days. So if we exclude that cohort of individuals transitioning where we know the assessments take longer for the right reasons, we're down to a 71-day average now for individuals from point of requesting the assessment to being able to be seen. And of the 871 individuals we've got on waiting lists at the moment, 50% of those are with an allocated worker, and so their assessments are in progress, but there's still work to do in terms of completing those assessments to show that within the data. We recognise that people on waiting lists within adult social care is a national trend, so we're not alone as an authority in having to tackle this challenge and trying to manage the demands of adult social care against a challenging workforce backdrop as well. And our staff are working really hard to try and make sure that we ensure if people are on a waiting list, we're doing that and enabling people to wait as well as possible. So again, as part of the targeted work that we've done, we've introduced a number of steps. So we've created a new staff guidance to give some assurance around waiting time. That's included a new risk management tool as well to make sure that we do see those most vulnerable and in need of interventions as soon as possible when required. We've also improved our advice and information offer to try and support as many people at the front of their journey into adult social care so that they don't need to come in and wait for statutory assessments. And we've had some really good success around being able to divert occupational therapy assessments, particularly into bookable clinics in local areas so people can access that support a bit quicker. In terms of the assurance around that, we've introduced monthly finance and performance meetings within localities as well, so that we're looking at the data and understanding how many assessments are being completed within teams. And we're also providing some more guidance for people when they are waiting, so able to signpost them to some support locally within communities, some of our new online resources to help them and help them get prepared for what information might be asked of them when they do have an allocated worker to support the completion of the assessments. How we've managed to tackle this waiting list. Unlike other authorities, we haven't done any additional resource in this space. We haven't brought in teams to kind of clear the waiting list and then let that build back up again. We've tried really hard to improve our practice, our performance, our monitoring, and get staff really involved in why it's important that we help people to wait as small as possible timeframes. So that's included some really great whole team focus days where the teams have been in the offices, they've rallied around together and contacted everybody on the waiting lists to try and see and sort and support those people with independence where possible. And in April, we'll be introducing a new building and independence strength assessment as well, right at the very front of the conversation, that will enable more people to access equipment, technology, community support and local support before needing to go into assessments. So there's been quite a lot of work done. Still a lot of work to do, but hopefully that just adds some context around the data that you're seeing today and the approach we're taking around assessments within the operational teams.
It sounds as though you have made good strides forward. I suppose the question that I've got in my mind is there a national benchmark of what we should be achieving?
So interestingly, there is not. There is not a national standard of how many days an assessment should take. We have, there used to be an indicator a number of years ago, but that was removed from the national arena. And also it's a very difficult area for us to measure because no local authority or local authorities commission their own tools, their own client data records, which means that you can't benchmark against other local authorities in terms of waiting lists because no local authorities can guarantee to capture that data in the same way, in the same place. And not even BCP, who also use a Mosaic, have set up their licenses in the way they use Mosaic in the same way that we have. So we've set internal benchmarks and we're working towards those. So our aspiration would be that we answer all contact assessments within 2 days, and we're quite close to that indicator, and that we complete all Care Act assessments within 28 days. You can see that we haven't got to that benchmark yet, but that's a benchmark that we set at the beginning of the year, so we're working towards that. Each assessment is individual to the individual, so it is not unsurprising that they take different amounts of time. And I think one of the things that I would really want to emphasise is the waiting well bit. We don't have people on assessment waiting lists where we haven't scrutinised the risk to them of waiting and maintain contact with them while they're waiting to make sure that they are well and healthy. And I know Amy and her team have really focused on improving that element of the work. And it's exactly what CQC, who we are anticipating will be inspecting us in the next few months, will be expecting us to have focus on. Questions?
I've got more of a comment than a question. Thank you. I think for this...
Can you remind us who you are?
Yeah. Councillor Carwood, Gillingham Ward. I think around this particular metric, it would be handy to have some context, as in new assessments that come in per month, and also the amount that have been kind of closed off or resolved in the month, just to see kind of flow the processes that's going on. Because obviously when you just see the numbers, you don't know if those are all new ones. Are there, you know, what's the process for kind of getting through them? So I think it'd be handy to have a bit more visibility on those kind of things.
So we can certainly provide that for you. If you're happy, we could prepare a paper for distribution to committee members that gives over the last year some of that flow detail.
Yeah, that would be quite interesting.
I've got the figures to hand if people are curious, that since the 1st of April, we've completed 2,707 strengths and needs assessments across teams and 2,284 occupational therapy assessments too. So we do know that whilst this waiting list challenge is difficult, the more that we can do the work we're doing to reduce that backlog that we've seen build up over time with better processes and better ways of working, we have the workforce that can manage some of that run rate in terms of what's coming in versus the volume that we're completing. Some of this targeted work has been really trying to get onto the front foot of some of those assessments that have perhaps been outstanding for longer.
Would you still like me to do the monthly flow, or is that, are you confident with that as a...
I think it would be nice to just see it on paper in front of me.
Absolutely.
Thank you.
The thing that strikes me, you've got a great distance in reducing the numbers. What are the barriers to getting to where you want to be, bearing in mind the current situation that we're in financially?
So the biggest barrier at the moment is that we have not been able to utilise a reablement offer at point of contact for people who are not coming to us through hospital routes. So the national best evidence shows that if you have someone who has an episode of health but in the community, so does not need a hospital admission, that sometimes what they are is imbalanced rather than have a permanent ongoing need. And if local authorities that have been able to deliver a reablement service that rebalances people and optimises them before they're assessed can slow down the entry into long-term care. So part of our transformation bid and built into the Our Future Council is the ambition for us to build in a community-based reablement offer so that all people coming into contact with Dorset Council will be offered up to 4 weeks. We're just testing it in pilots, but at the moment the plan is up to 4 weeks reablement service to rebalance them. Now the pilot we're testing is on very small scale because obviously we want to test it to make sure that it's right, but there's very good national evidence that shows that this will make a significant difference. It'll make a difference in 2-3 places. One, it'll improve outcomes for people, because people don't want to come into social care if they can avoid it. 2, it will help us to manage our demand, which means that we can use the skills of our social workers and our occupational therapists where they are best needed. And thirdly, it will help us to manage the cost impact of bringing people into care.
So is that something members would want to see more on as the outcome of the pilot, or is that something that should go to overview? I'm just sort of throwing it out there. Sally.
Councillor Sally Holler, Chelsea Bank Ward. Just using the early intervention process is so much better than waiting for a crisis to happen. And I think if you can, it helps keep people in their own homes and also keep their independence. So it'd be really useful just to see how much of that you're able to do and whether you actually look at increasing that. It depends how you get to know that someone is coming into that point where they might hit a crisis. So how do people kind of come into that where you know that they need to be reablement?
So at the moment, the 2 places where we've tested to date are both in our adult access team, which is why I talk about it being part of our future council offer, because that's that first point of contact. And we've got a very small pilot using Care Dorset, who have a reablement offer that's largely used for the hospital. And we're doing a very small pilot with people at that point to see if we can make a difference. And we've put 2 occupational therapists into our adult access team to scrutinise contacts as they come in. And they've made a significant difference. That's reduced our occupational therapist referrals going into our locality teams by 67% in the time we've been using them. So we've got emerging proof of concept, and as I say, as part of our transformation plans, we're hoping to expand that out and develop that as our offer to all people coming in.
It actually becomes a benefit for the hospitals as well, to keep people out of the hospitals, because they get in there and they take a long time to come out. So if you can actually catch them early and prevent that, then that makes a massive difference.
And it links in ultimately with the work we're doing in part of the integrated neighbourhood teams work with the NHS about how do we support people in the community to be as well as they can be, and both prevent hospital admission, but actually just have a healthier Dorset community.
So how does all that fit in with the, for example, the discharge lounge at DCH?
So, well, there's a programme of work called Future Care that you might have heard of, previously labelled under urgent emergency care, which again is an integrated partnership piece of work looking at managing flow in and out of the hospitals. And they have 2 particular work streams that are looking at reablement as one of the discharge pathways. One is a bed-based reablement and how you use interventions in bedded facilities to stop people, to support people to recover from a hospital admission. And the other is a reablement service that is delivered in people's home. That's emerging work. The work streams for that are just being developed as we speak. And I would anticipate that at the very least that feeds into the Health and Wellbeing Board, and therefore councillors can scrutinise it through the processes there. But there's very clearly an interface between the 2. Sorry, I couldn't remember what it was called for a moment.
Previously known to me.
Yes. Are we getting
So
enough?
do Chris first and then
Oh, sorry, I beg your pardon.
Chris Kimbax, Yetminster Ward. I'm interested in the reliability and the thoroughness, I suppose, of managing the waiting list. I'm characterising, not saying this is what it's like. You know, it's one thing to pick up the phone or to contact and say, "Oh, you're right." You know, "Oh yes, I'm managing." You know, and that could be counted as they still don't need any services. And who knows when they might. But you know, there's quite a difference between that and going, you know, tell me about your circumstances and what why you think you might need us or when that might be, you know, and being thorough about it. So, and the elements of risk in that, management, good management. And I'm just wondering how that, because I've heard about triaging and cases and inquiries and almost pre-triaging as well, from what Amy was saying, you know, the community initiatives as well. So that may take it back and even earlier to an earlier stage, not sure what that looks like. So, you know, can you just unpick that for me to give some reassurance about how that will, how effective that is, I suppose.
So I'll start and then I'll ask Amy to come in and give the detail. So our point of contact into Dorset Council is through our Dorset Direct customer service. Adult social care is quite unique within the council, that we have a specialist service that sits within Dorset Direct, which we refer to as our adult access team. Now that sits within the the corporate part of our organisation, but is actually staffed by qualified social workers and assessment support coordinators who are skilled and trained in adult social care. So they are the individuals who have those first level conversations with every customer that contacts us as a new individual, and they do that initial triaging. They do that signposting where appropriate out to other organisations or linking people into information, advice and guidance or the communities, but they follow the principles of the Care Act in terms of the categories that they look at, and they're also one of our main routes in for any safeguarding inquiry. So if there was an immediate risk of harm, for example, and it required a safeguarding response, then they would be one of the routes of triage into the safeguarding service. So we have a really good safety net at that first port of call. But one of the things we're ambitious to do is actually develop that further and give that particular group of people more control to make decisions at that point in time. And the purpose of our reablement would be to empower that group to put in reablement at that point of contact, so that people then don't need to go into a waiting list to get first interventions going in to support them. So that's the ambition around our transformation work and what we want to do differently. I'm going to hand over now to Amy in terms of how we're managing that risk once people have come through that door, if that would be Amy.
Thank you. So yeah, as part of the work that we've been doing, we've got a really clear risk matrix tool. So we recognise that, you know, individuals who need to be seen will go straight to our duty teams to be supported by workers. Also, just because somebody's waiting for an assessment, it doesn't mean that they aren't having some form of support or intervention with us as well. So sometimes there's work that's been going on to support somebody and they might not have had the strengths and needs assessment completed, but we've put some early support in, whether that's basic pieces of equipment or linking to some community kind of opportunities, but people still need likely need onward services from adult social care. I referenced about the fact that we've kind of tried to change the team culture in all being responsible for waiting lists and making sure that it's everybody's business across social care teams. So when I talk about recontacting people who are on the waiting list, that's not a telephony system or just somebody going, hello, you're on a waiting list, are you okay on it? Thank you, goodbye. That's the team wrapping round together, and we can, as part of the kind of assurance report that we can provide for a future meeting, where people can complete the assessment during that telephone call because actually the right information is available and we can move the cases on. We are doing that live within that conversation with people. So we are seeing quite a lot of success in that new approach and the team all taking responsibility for making sure that we don't simply move people into another tick box along the conveyor belt of processes, and that actually if we can have that meaningful conversation as part of that kind of monthly touch point where we can do something in that space, then that's where we're doing that. So we are seeing that some of those telephone calls and conversations are translating to completed assessments and work being finished for people, so that we can support them as early as possible in the journey.
Thank you. Thanks. Very satisfied with that. Thank you.
Carol Jones, Minster Newton. I was just wondering about the crossover between Dorset Council and Health, because I just rather get the impression that more and more is being put on Dorset Council, and you know they'd quite like to Health would quite like us to sort of just stop people coming into hospital, look after them at home, rely on the voluntary sector, and just wonder how do we get enough funding from Health to actually do what we do? I mean, where is the crossover, and are we having problems with Health saying, look, this is what you should be doing, this is what we should be doing? I just have some confusion over that, really. Sorry. Do you want
to we have wonderful relationships with our colleagues. Sorry, Steve Robinson, Portfolio Holder, Adult Social Care. We do obviously have wonderful relationship with our colleagues in Health. But as I think I described to Councillor Parry a few months ago, it's a little bit about like England's relationship with France. Underneath it all, there is a firm foundation interspersed with occasional squabbling. And we are very aware that NHS has huge financial pressures at the moment, and that they need to take every opportunity they can to make sure they're making the right decisions at the right time for the right people. What we're also finding is that obviously as a council we would argue, greater pressures for delivery, and there are times when there are ongoing discussions about cases that we would disagree with their interpretation of. I'm aware this is a public forum. However, having been involved in a few of these now, and maybe yourselves before that, we do have a very good team who are able to make a good case. Where things can become difficult, I think, is where there is funding that goes into the private sector, into care homes. And I think there will be an increasing demand upon the voluntary sector as well. And so, as you know very well, part of our ambition overall is to develop working with the voluntary sector and work within communities considerably in the coming months and years. Individual cases, there are many of them. We were talking this morning, actually, we particularly welcome the fact that much of the NHS is moving into this building, which will allow us to actually go and talk to individuals rather than just send emails, and that will help communication across the board and speed things up. So it's a roundabout question, but I think we all share concerns about the funding of all of our services.
If you're happy for me to come in, Councillor Robinson, I just wanted to provide a couple of live examples of where we are actively working with our health partners to try and ensure the best education around what needs to come to adult social care and what can be solutioned in other ways. So we have a couple of examples that we've got officers currently working within the single point of access with the NHS in those hospital teams to think about and educate those health staff in ways that needs can be met without needing to translate to an assessment in adult social care. So that's been taking place recently. And Julia referenced our adult access team, so the workers at the very front of conversations, and they're all trained to know what are health responsibilities. So where if somebody presents to us and actually the better team to support that person would be our community health team or community rehab, then they'll make direct referrals over to those teams to support the person to get the right part of the system and have that one conversation opportunity too. So that's kind of just a couple of live examples of how we're trying to support that. And most recently, we've been doing quite a lot of work with South West Ambulance Service around the ambulance crews, and there was quite a kind of a method of simply always referring to social services because it's a social care challenge, and actually trying to re-educate that and trying to help them understand the difference between welfare concerns and safeguarding concerns and how we can kind of make sure the right information is going to the right places. So hopefully that just adds a few live context examples for assurance.
Thank you, Amy.
And I'm Mark Patton, I'm Corporate Director for Commissioning and Improvement for Adult Social Care. I think I was just going to add as well sort of a bit of the strategy context, because I think there's in a sort of strategy level, so we do have investment from the NHS into our recovery and community resilience contracts, into some of our bedded re-enablement with Care Dorset. And also they invest in some of our services that support the hospital discharge pathway, so the care allocation team, for example. Yes, we have had debates about the level of that investment, but I think what's important for the future is to acknowledge the future care programme and the integrated neighbourhood teams as both being ways in which, instead of having that debate about particular areas of investment, we start focusing on the preventive benefits, the financial benefits of preventive activity and joint funding of that, and shift that emphasis. Now, we know that when we do shift that emphasis, because of where our teams sit, because of the work we do, we're absolutely in that space. And that's not to say the NHS aren't in a preventive space, but we're very significantly in that space together with our community partners. So I think, you know, that's where the longer term questions about where money flows and whose money flows where will be answered and resolved in a kind of much more sort of in a set. I'm trying to avoid the word holistic, but yes, that word kind of way.
Thank you. I'm going to move us on now to the next item, which is the number of reported crimes. Chris.
Thank you. Okay, and here's the information for that. So the data as of November is 1,519, which again is higher than last year, hence the red status. I'll hand over for further discussion.
Could be me. Councillor Jill Taylor's online as well. So if I open up and Jill can come in if she wishes to. On behalf of Andy Frost, who leads our work with the Community Safety Partnership, what I'd say, now avoiding the question, so it's a very complex indicator that is partly owned by us, but predominantly a police indicator with the data on that information reported up through the Community Safety Partnership, which Jill chairs. So the request today, or a suggestion or a request, is that, as I think was mentioned at a previous meeting, we're due to come to this committee with the Community Safety Partnership annual report, annual plan. It was last year, it was August, and this year I think we would like it to be June, if that's workable. And what we could do is to do a much more analytical response from the Community Safety Partnership on that topic, because it's a very broad heading. So crime could be anything from low-level crimes through to high-level crimes. So I think it's just in our recommendation, based on Andy's recommendation as well, and discussion with Jill, is I think we benefit from a more nuanced analytical report. Short answer is we can't give a full response today because it's very much the domain of the Community Safety Partnership, but it's something, recognise the interest in that area, particularly if that overall figure is going higher.
It's come to us because obviously it's automatically flagged red, so
yes,
that's one of the reasons why. I'm just having a quick look at the forward plan. We don't actually have the June meeting populated. So Georgie's saying yes, that's fine. He's the one that's got to populate the agenda. So if we'll take it in June. I'm just wondering whether we need any partnership attendance, i.e. someone from the police, maybe. I don't know.
We could take that away and talk to, as I say, Jill,
discussion outside.
See whether that's something that,
because everything now is in partnership, and I don't. In some ways, it would be wrong if we just dealt with the Dorset Council side of things. If we want to make things better, we need to tackle the whole partnership, and we do have the right to ask people to come and talk to us.
Indeed.
So
pass on that.
Have a conversation outside, and we'll see more information in June.
Just had a message from Andy saying absolutely we'll probably get police to attend, so that's perfectly doable.
Lovely, thank you. Jill.
Sorry, no, I just wanted to come on back on this, and I very much endorse the approach that we're looking at for this. Our big problem is this is all data that is held by the police rather than by the council, so we can't just instantly produce that. We need to go to them and basically get the information from them. But it's something we actually absolutely should be looking at, because this is the council's crime and disorder committee, so absolutely we should be doing it. I did just want to make the point, because one of the things that was asked for was a breakdown of crimes by ward and age, and I think that is going to be quite difficult to do, simply because the crime data doesn't work on our wards. So we'll see what we can do on that one, but don't hold your breath on that, because I don't think we can do it by wards unless somebody's got some really clever stuff these days. But I certainly look forward to coming and bringing a paper on this in either June or August when we do the Community Safety Annual Report. Thank you.
Thanks, Jill.
Sorry, thank you, Chair. I think when you just see number of recorded crimes, is there any way of breaking down into whether they're physical assault or robbery or just shoplifting or minor, or because I don't know that we can tackle or do anything without knowing exactly what's happening Where in that respect?
And so, I mean, in broadest terms, that's what I meant by having a more of a nuance.
Oh, okay.
With that, and if we can get to come, I think that's a good suggestion.
Okay.
That would be,
Okay.
then we can interrogate
Thank
on
you.
those very points. Because as you all know from your own wards, every ward's different.
Yeah.
And people experience crime in different
One
ways.
thing I am aware of, because I sit on Verver Town Council, and we've always had a monthly police report. And sometimes we don't, and then we have to fight to get it back. But on the new police website, you can actually drill down through data into a much more local context. So if you're interested in your own particular area,
yeah,
after the meeting, I'll see if I can get the details of where you need to look on the website. But it might help you if you're looking for your own personal wards, and the same goes for any member on the committee.
Just to can I just say, just to echo Jill's point, though, it is some of it expectations we need to manage around the quality of that, but we'll see what we can do.
Yeah, but what I'm saying is on the police website that you can actually access the information directly. So if members can then do that, they can then look at it in a way that perhaps suits them better without you having to do all the data handling.
Sure.
So I was trying to get at it. Okay. We'll move on then to the next one. And that's the percentage of 16, 17-year-olds who are NEET, not in education, employment or training. So Chris, do you want to start and then we'll move over to Paul?
Sorry, was that for me to comment there? Sorry, I missed the comment. Yeah, sorry. Okay, so the period for November, we read RAG rating in 3.8 in terms of the figures, which is above the target of 3% there. Commentary went into some detail around the highest proportion being elective home educated, which was the area for discussion at the pre-meeting, and the context and what actions were being taken.
Thank you. Have explored this. Beth's going to
respond. So, Beth Whitaker, Interim Corporate Director, Education and Learning. So I've got information here from Simon Fraser-Brown, who's Head of Commissioning for Family Help. And I think the important thing to note here really is, although we've got an increased raised number of NEET, we just need to understand that in the context of regional and national data, and that of our statistical neighbours as well. And that the Dorset NEET rate is higher than our statistical neighbours. However, we've got the lowest not known rate of our statistical neighbours. So we've put considerable effort into reducing our not knowns, and that we have found that most of the young people where their status has not been known is NEET. So what we've done is, in the short term, some of the actions that we've put into place to address this. I also just want to add the caveat that this particular current year 12, 2 points, there are 400 additional young people in that year group. And secondly, they are the year 7 from March 2020 that went into the first lockdown. But in the short term, we've been sharing destination reports with individual schools so that they understand the destinations of their year 11 leavers. And post-16 destination information is actually part of the Ofsted framework. So schools have to report on that and be cited on that. We've got enterprise coordinators who are working as part of the Dorset Careers Hub to support schools, careers leaders. And they've also received the information on individual schools to inform their discussions and to enable supportive conversations. And I know you referenced particularly EHE. So as an aside to that, we have set up more recently an elective home education task and finish group. We've got wide representation on that from electively home educated parents. We've got team managers within our locality, and we've got the voluntary community sector involved. And we've just been revising the parent carer guidance, which will go through our policy practice committee shortly. And within that, we've been looking at how we can reach those families in terms of their duty to support their young people in looking at next destinations. So we've had a meeting with the Dorset Careers Hub, which is actually going to be hosted by Dorset Council from the end of March. And we've asked that they can put on some sessions, provide some information and make contact to our EHE families around specific careers events that are happening. And then because we have a parent representative on our EHE group, she's extending that invitation out through social media. So that's one of the things that we're doing. Information around our NEET numbers is also shared with our inclusion teams within our localities. They have the managers from the EAT team attend the inclusion meetings monthly to discuss NEET prevention strategies. Our EAT team members, also managers, attend a careers leaders meeting organised by Dorset Careers Hub. And this is really useful in highlighting careers leaders, which young people can focus on over the next few months to ensure that we are putting in as many measures as we can now to prevent NEET at the end of this academic year. We've also been running next step events through our EAT team and coffee and carers mornings through the Dorset Careers Hub, which has taken place during the autumn term, so that they are supporting those young people that are currently in year 11 and are vulnerable to becoming NEET. We know that the NEET rate is higher than we would like it to be, but we are actively tracking this through our Children in Care Inclusion Board, as well as through our monthly performance boards. So longer term, when the Dorset Careers Hub will be hosted by Dorset Council at the end of March, we will be working much more closely with them and will be able to align the NEET team coordination. So, for example, they'll be running joint events, providing careers information, advice and guidance, targeted specifically at those young people who may not be able to access that careers information through their education provision, or particularly for those who aren't accessing full-time education. Dorset Careers Hub have also received short-term grants to deliver additional work experience opportunities for secondary-aged pupils in this current academic year. And this is part of a pilot from the central government's aspiration to ensure that all secondary-aged children and young people receive at least 2 weeks work experience during secondary school. This programme is going to enable us to form links with business leaders and local companies as part of the wider aspiration for our economic growth strategy. We also have a team of education challenge leads who work alongside with the newly merged Kingston Moorwood and Weymouth College, and they are addressing an anecdotal piece of information that we've heard that some young people are struggling to access courses as they didn't receive sufficient grades in English and maths. So it's also looking at that kind of curriculum provision for our EHE community in terms of access to examination centres. This is something that they have flagged up for us this year, and we're in the process of setting up an examination centre at Dorchester Learning Centre, which will then enable our current Year 11 who aren't necessarily accessing full-time education in school to access their exams, which hasn't been as easy to do up until now.
And there's always been an issue, hasn't there, about schools allowing home-educated children in to do their exams?
Yeah, and not all schools will take private candidates. So we've redressed that by setting up a centre next year.
Thank you. Can't see any questions because this sort of rolls into almost straight away into the rate of permanent exclusions. So I just wonder whether if we get the narrative around that and then see if there are any questions, because the two are linked, aren't they? Exclusions and needs.
Yeah, I think I'd like to go away and drill down into the data on that to be absolutely precise for you around that. Yeah.
Sorry, Chair. Carol. Is there any way of understanding whether some of this problem is down to a lack of transport and access to education, to further education, and to employment and apprenticeship opportunities?
Yeah, you know, that we have had discussions around the geography of the authority, and that, you know, some young people get places in college and they start off, or, you know, a place on an apprenticeship, and they start off with good intentions, but then due to, you know, if they miss the bus, then obviously transport arrangements aren't as fluid as they might be in an urban area. So sometimes that makes it difficult, and then, you know, sort of disengagement can take place.
Can I ask if Nordcat has had an impact?
Sorry,
Nordcat.
I'm not familiar with
it. They've closed now. They're closing now.
It's a community
transport.
Oh,
okay.
In North Dorset that is
right. Okay.
So we need to know if there's any impact on our young people accessing education.
Is there any way of seeing a map where you can actually have numbers of children in each area, so that we can actually, is there a greater problem in rural North Dorset, for example, rather than the south, or whatever? Because I think if we could drill into that, we might be able to come up with, I don't know, we could brainstorm it. We could brainstorm it. Geographical hotspots.
Yes. We can break it. We can break the numbers of NEET down to each locality. Yeah.
I think that'd be interesting. And if that could be fed through to the lags, that would be good. Let's make that, you know, that could be very good to look at for the lags.
Do you want to hear more narrative around the rate of permanent exclusions, or are you happy to get the data?
It's just so depressing.
Maybe it's got a lot to ask for. So in that case, Chris, thank you very much, and also to you, Amy, and the rest of the team for all the answers you've given us today. We're very appreciative of that. We then move on to item 10, which is committee and cabinet forward plans, which I know is the exciting one of the day. So, right. As we said earlier, George will sort out the date for the meeting in March, and that will be a one agenda item meeting. We won't sort of use it to shuffle in anything else. Then in April, we have 3 substantive items: housing strategy, cost of living support, and again, children who are NEET. So perhaps you could feed into that some of the questions from today. Would be quite useful. And then we've obviously got other bits and pieces. From Robin's input earlier, we are going to look again at NHS funding and hospices, just to understand the context of that a bit better. And we also, I'm going to do some, again, some contexting to understand the issue more. We'll look at end-of-life care, because that is also becoming prevalent. Is there anything else that anyone added, James?
Yes. Councillor Robinson wanted to speak, but I just wanted to ask about, on that forward plan, there's a piece on the public health disaggregation, and I'm just wondering if it might be something to consider, you know, 6 months' time, 8 months' time, to look for Scrutiny to look at how that's unfolding for our residents. Yeah. I'm aware it'll probably be something that comes up at the Health and Wellbeing Board, but I think for our residents, of a look at the scrutiny side of the success of that, because it's a big move away.
Yeah, but public health is now solely within our purview, so I don't have an issue with that at all.
George, I love being called Councillor Robin. Makes me
Sorry,
feel
Robin.
I've got a little Winnie the Pooh with me.
That's Christopher Robin.
With regards to the funding for end of life and hospice care, I heartily endorse that discussion. I think it's something we need to express and concern about. Could I suggest that we enlarge it to include CHC continuing healthcare as well? Because it's all areas that are actually under threat, we think, from NHS funding.
We'll look at it as part of the scoping.
Well, thank you.
Chair, sorry, could I just ask, in terms of housing and temporary housing, whether we could just sort of look further or get some metrics on how long voids, or whether we can target ourselves to always have voids that are certainly no longer than 28 days, but are actually far less, and maybe actually see how many go beyond 28 days, even to 60 or 90 days, and try and understand why, or whether there's a lot of, is there a lot of damage in some of these properties? Because we've still got quite a number of people in temporary accommodation and B&Bs really. So it's just.
Sorry, do you mean in
the voids in
performance?
Yes, yeah. So whether that's a performance metric or whether that's a separate item, it's just looking to see how can we move people along.
We don't have that in our.
George is just suggesting an online briefing.
Okay, that's fine.
Starting point,
yes,
and then
yeah.
Further, we can investigate it further.
Yeah, if that's okay.
George, from memory, is that in our performance lines?
Some of it is.
I don't think voids are not in the performance lines at all.
Yes, yeah, I'll feed that.
I think if that was in the lines, that's probably all we need, because we could pick it up if there was a problem from there.
You're looking at me, Councillor. I mean, online briefing, as Phil suggested, but we can look at how we get that measured as part of the force metrics. Fair point. So we go at it from both angles.
Yes, in a performance, if that's a separate line of performance metric. That's
just say one thing, just as a bit of a plug, because we'll be coming through cabinet and overview, and the housing strategy paper we're getting here is very much part of the new models of housing delivery we're looking at, is to get the most housing we can, and that includes empty properties, that includes foods, that includes new homes. So I think read in the round, I think you find that useful, but we can happy to do the online briefing, but also the performance report.
Anything else on the forward plans or the
It's the question, where we're doing the children not in education, employment or training bit, would that include exclusions and attendance kind of elaborations in that, just because it might be kind of connected in some way?
Yeah, so what I can do is I can get a breakdown of all of our neat figures, and how many of those were permanent exclusions, and look at it from that way, and maybe we go from there. And then obviously the exclusions and attendance piece is quite significant in its own right. So yeah, so maybe I could include that as part of the neat feedback to start off with, and then once you've seen those figures, we can go.
It'd be interesting to see if there is a correlation.
Yeah.
Thank you.
If there are no further questions,
excuse me,
Julia.
Based on the conversations today, I wondered if you would like us to bring a paper in about 6 months' time, updating on the assessment waiting list, and with an update on those reopenment pilots and any learning from them.
Any nods?
Yeah.
But obviously, in the meantime, we will continue to look at it through the performance monitoring.
Absolutely, and we will do that flow of contacts in and resolution.
So, moving on quickly while I've got the opportunity, we have no exempt business. So at 12:21, thank you all very much for attending and your participation today. I close the meeting.